The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everybody. Thank you so much for taking your some time out of your busy schedules, what I know are busy schedules, to listen to the presentation that we have pulled together for you today. This is the fourth in our webinar series on exercises medicine on campus. My name is Dr. Renee Jeffries-Heil, and I am the current chair of the Exercises Medicine on Campus Committee. We have two fabulous presenters today, Kori Hahn, who is one of our student representatives, and then Professor LaKisha Nickens-Gaither is also going to talk about her program as well. You are all muted during the presentation, but there's a bar on the right-hand side where it says questions. Feel free to enter in any question that you have as the presentation goes on, and at the end, we'll have about 15 to 20 minutes to answer all of those questions. So at this point, I'm going to turn it over to Kori to start the presentations, and I will see you guys all at the end. Thank you.
Thank you, Renee, and hello, everyone. Good afternoon. I am so excited to be here and share a little bit of what exercise medicine looks like on UTC's campus. I have now been serving on the Exercises Medicine Committee for this past year, and just a little more background about me. I transferred into UTC as an undergraduate, finished my bachelor's in exercise science. In my senior year of that, I got involved with some research, and that's when I first learned about exercises medicine. Dr. Carissa Pyer, who had been involved with the initiative at Iowa State and Michigan State, had given me a little insight, and then I immediately came on as a graduate student and assistant, in which I was able to be on the leadership team for EIM for UTC and be a part of some of the initiatives involved in that. I am also the Public Health Student Association president and have been able to use those personnel and manpower to do some other EIM work. So I'm excited to be here and again share what developing campus support has looked like at UTC. We're pretty lucky. It has been fairly smooth. A little bit about Chattanooga. We are the fourth largest city in Tennessee with a population of about 180,000. And it's a very beautiful, scenic city. Lots to do outside as far as hiking, things on the river, other ways to be active. We're a classic mid-sized university with around 10,000 students. Undergraduates make up the majority of that. We have a good number of athletes and a decent amount that live on campus. And so not only is our city very conducive to physical activity, we're lucky that our campus is as well. Without all EIM initiatives aside, UTC has bike share stations all over campus, which students really are able to take advantage of. We have several different rec fields. We have the Aquatic and Recreation Center, more commonly known as the ARC, which we all love to brag about, this huge facility that has tons of group classes, bouldering, rock walls, belays. We have a huge aquatics facility that has a lazy river, kayak plunge pools, volleyball courts, lap lanes. They do all sorts of fun things in there to promote activity, especially during finals time. They'll do a study and float, and you can laminate a sheet. Just get everyone in there. The outdoor equipment rentals are something so awesome for students at free or very little cost. You can rent any type of camping equipment, paddle boards, kayaks, bikes, tents, anything. So students have a lot of options right off the bat to be active both on campus and off campus. And so bringing exercise medicine to UTC happened right at 2016. And so Dr. Carissa Pyer, who I mentioned earlier and who introduced me to exercises medicine, made the initial contact between our Department of Health and Human Performance and Student Health via email. Simply reached out and said, hi, this is what this is. This has been my involvement in previous schools. Can we talk more about what it would look like bringing it here to UTC? And so only a few weeks later, she met with the Assistant Director of Student Health Turns out we were already assessing physical activity as a vital sign. It was one of the standard intake questions in the EMR, and that was a quick, easy, okay, check. So to make the system complete, we just need to have referral. And then another meeting was set up with a broader view of campus personnel to see what a referral system would need to look like with everyone. So the chancellor, other people from student health and nursing, we got campus rec, the fitness director at the ARC, and a few other faculty from different departments all talked about how this would best come into play. We established a fairly simple system, and then in October, for Exercise is Medicine Month, a presidential proclamation was made to let everyone know that Exercise is Medicine was coming to our campus and what it was all about. And in November of that same year, the referral system was implemented. And so in just a few short months, it was a smooth process. We applied for recognition that first 16-17 school year. And so what our referral system actually looked like I said, the physical activity was already being assessed at every intake, and we simply used Exercise is Medicine's prescription pad. And so those who were not meeting the recommendations were given this pad. The nurse practitioner doctor talks through what type of physical activity, how it would best fit into their lives. And the real key piece here for us was this highlighted referral to our health professional. Scarlett is the assistant director over at the ARC, and she will take students who contact her with this information and give them a nice overall view of the ARC, set up a meeting to not only talk about how they can be more active, but a tour of the facility, group class schedules, into the equipment checkout, any other questions they may have, let them know about, we have small group training, the larger groups, and any events. We have a Couch to 5K, whatever is upcoming at that time to make the student most informed. An overview or a snapshot of what our original leadership team looked like. That main supervisor advisor is the assistant professor, and the professional at student health is the nurse practitioner. Scarlett, our associate director of campus rec, serves as our health fitness professional and still does. And then the two students originally were a psychology undergraduate and a physical therapy graduate. And I think that's important to note that you don't necessarily need students in health science majors. Anyone interested, Exercise is Medicine is all-encompassing. So the real piece of what today's talk is about is how we merge the education and academic side with the recreation side of campus to make Exercise is Medicine on campus successful. And for us, the key original piece was this intentional relationship building, and one that is mutually beneficial from the beginning. And Dr. Pyer was fortunate enough to have received a small grant and started a pilot study for peer health coaching, which was the first real event that we collaborated with Campus Rec on. And I think being able to come to Campus Rec with something, and specifically with funding, to say, hey, this is what we want to do. We will able to pay your instructors, and this will be mutually beneficial for marketing and promotion, and bringing something to the table. I know Scarlett shared with us that it's so important not to assume that student or campus rec rather has the resources and ability, the desire to want to collaborate and to promote programs and put on events may very well be there, but it's important not to forget that they still need to pay their instructors and staff, etc. And so being able to say, let's do something together. This is what we can do on our end. What else can we all do to make this work? And from there, the physical activity programs and events really the ARC takes the lead on. Not only are they hosted there, but they come up with a lot of the programming. It's their personnel that puts them on. And while the more academic and education side has been involved, it really, the ball is in their court on that one. And then flip side of what the academic side tends to handle a little more is the measurements and the data collection of the initiatives and programs. And then meeting back halfway in the middle, the marketing and the promotion of these programs and the putting the word out on campus has really, we've done a good job here at UTC of sharing that responsibility with emails, flyers, all other types of marketing and promotion to not only share what programs you're doing, but what everyone else is doing on campus. A little bit of what our growth since EIM-OC has come onto campus looks like. We're proud of this one I mentioned earlier, that peer health coaching. So since 2016, that came into play. The small group training was a part of that, but also existent outside of health coaching. We have Wellness Wednesdays, Women on Weights. We do a group fitness launch every year. They started one of the newer programs this past year was Unleash Your Inner Blank, a very empowering, non-defining what fitness looks like for you, what gets you fired up. Unleash your inner warrior, your inner diva, your inner anything. And other things such as the Couch to 5K training program is something that came on recently. So big picture of what our successes and challenges have looked like here. The referral system was overall a success and a pretty easy check mark because of already having the assessment piece there. Flip side of what's been challenging for us is tracking these referrals. So those prescription pads that I showed earlier are numbered in the corner. And so as far as knowing how many were handed out at the end of every year is easy to look at. But we have only received a handful to Scarlett at the ARC. So it's hard for us to know if any students who have contacted her for further information, if they didn't mention the referral, if that was there or not. And that is something we're working on having a better system for and figuring out how to work with HIPAA to have a follow-up piece so that when we have a record of who was referred, we can then have a middle area of let's follow up, let's give them more information. If they may have been hesitant to go ahead and reach out to Scarlett themselves, how can we help that? The partnerships and the expansion of the programs have been a real success. The pilot of the peer health coaching also went really well. Though the small funding was gone, it rolled out again this semester and is doing really well. And another challenge is the bridging that gap, the integration of the programs. There are so many things happening here on campus. We have different healthy initiatives. We have a public health program. We have our exercise science. We have our tourism and recreation, and so many people that are doing activity and not doing it together or not talking with one another about how we can bring departments together for students' sake and big picture exercises medicine UTC sake. One of the big lessons that we have learned in our time of having exercise medicine on campus is the importance of having that champion at student health. Our student health representative has been phenomenal and really herself values the importance of assessing physical activity. I've heard from other schools and people how tough, especially during flu season and other heightened times where there are wait lists, there are tons of people in the lobby, and when you're doing those intakes, it may be easy to say, okay, we're going to skip asking about physical activity while this person is running a fever or has the flu and there's 5 other people waiting right after. So having someone who is passionate and dedicated to exercise medicine in student health is really key. Student involvement follows that with a close second in what the representatives who are on that leadership team, how they are involved in the type of ownership they take. I know personally the last year that I served, helping with the recognition application, helping get the word out there because of my student organization, able to work some events into that. But I think from the beginning to lay out the roles and responsibilities and get students more being those boots on the ground, getting down there and saying, we're promoting all types of events, whether it be in dorm rooms, in classrooms, on social media, really pushing the promotion. And again, that communication across campus, people from every department, all sectors, how do you get them involved? How do we all talk? We had a few signs pop up on campus recently that just show the walking distance from here to the river, from here to the rock climbing gym. And we were like, oh, that's awesome. What a great promotion to show that, it's only 4 blocks, a 15-minute walk. And we still were like, we have no idea who even put those up. And so to communicate with one another, let Exercises Medicine really be a central hub almost of everyone who's doing anything physical activity, health promotion related. Let's bring it here. Let's put it here, whether that be a forum, its own link on your university's camp website, whatever works best for you. Having that known that this is the place to share these ideas and work together and have support and have manpower for these events and initiatives, because it's important to all of us.
Thank you very much, Kori. We're going to switch the presentation over to Professor Nickens-Gaither and let her take it from here.
Thank you.
All right, so once again, I want to thank you for joining us. So I'm LaKisha Nickens-Gaither, and I'm the supervisor of the Exercises Medicine program here at Montgomery College. I also serve as the exercise program coordinator for the college as well, and I'm also a faculty member. So I would like to start by giving you an overview of Montgomery College. So Montgomery College has 3 campuses located in Montgomery County, Maryland. So it's also a 2-year college, so different from many of the others that have been on the webinars. Our college is actually a 2-year college. So we have about over 50,000 students, credit and non-credit students here. We also have about over 3,000 employees here at Montgomery College. So in 2016, our Health Enhancement, Exercise Science, and Physical Education Department, we implemented the Exercise Medicine on Campus program. And so like many of the other programs, we started out with the traditional leadership team. So we have the supervisor, advisor, which is myself, and our healthcare professional was a faculty member here who's also a nurse and works with one of the partner hospitals, which is Holy Cross Hospital. The health fitness professionals consist of our exercise science faculty that's involved in the program. And our student representatives are exercise science majors that are in the capstone course. So that's the last course that they actually take and they represent the program by providing many of the activities that we have on campus with Exercises Medicine. All right, so our program, like I mentioned before, started in 2016. So we initially started on one campus, which is the Rockville campus. And so on the Rockville campus, we started, and instead of doing Exercise Medicine on Campus month, we did an Exercise is Medicine on Campus week. And so during that whole week, we had various activities available to the students. And then from there, we actually grew, and now we have numerous programs across all 3 campuses. So our top 3 programs that we have is the 30-day swim challenge. So we opened up a 30-day swim challenge for people to sign up across all 3 campuses. And we tracked their attendance, and then they were given challenges. So they had specific workouts that they would do in the pool that they had to complete, and they would get credit for once they completed that challenge. One of our other biggest programs is the Zumba Against Cancer event that we have every year, and we actually hold that event during Exercise Medicine Month, which is in October. And lastly, the annual health fair is probably one of the largest events that we have every year in April. So we have various vendors that come in, and we have student organizations, different departments that come together to provide physical activities and health information sessions to our students, faculty, and staff, as well as the community. One of our newest programs is the 4-week personal training sessions, which is a part of our Exercise Science capstone project for our majors. So students are basically assigned a client based on that client's goal and compatibility with the actual trainer. So we look at, so the client actually fills out a form, and on that form they put their goals and then their preference, whether they want a male or female trainer, and then that client is assigned a trainer from there. This program just started this semester, and so we decided that we wanted to start off small. And so with the program, we're only looking at participants of our wellness program, so employees, faculty, the faculty and staff, as well as students that are participating in our open fitness hours. So those are our participants in the 4-week personal training session, which eventually I foresee growing and being open to the entire college. So let's talk about some of our successes here at Montgomery College. So one of our biggest successes would be our collaborations with a few groups on campus. So Campus Recreation, which is they actually is a part of our department, and we actually run the open fitness hours for the students on campus. And so our collaboration with that, we've been able to open up more fitness hours. The students in the exercise science program have been able to run some of the campus recreation hours, and during that time we offer various assessments and challenges to those that participate in the open fitness hours. Another collaboration that we have is with our Next Generation Wellness program.
So they have been beneficial to us. In our collaboration, we've been able to put together some big events. So the Zumba Against Cancer is one of the big events that we collaborate on. That's held every year, as well as fitness assessments that are available to employees, faculty, and staff. And we've also collaborated on other activities. In addition, MC Next Generation Wellness has been beneficial and supportive in helping us to market our program. So they capture the audience of the employees, and they have been very supportive in that endeavor. Come Back to College is another program that we have, which they offer support to our veterans on campus. So they offer open gym hours to veterans on campus. They also participate in our annual wellness fair and offer yoga sessions. So we've been able to collaborate there. And then Student Life is another support for us. So Student Life, as you know, they host many events on all campuses, and so Student Life has been supportive in providing marketing to us, as well as collaborating on with many of our events. So the Zumba Against Cancer, and providing us with giveaways and any other resources that we need to support our program. So the student clubs, we have been able to collaborate with student clubs on campus and offering educational seminars, and they have been supportive in spreading the word on campus about our exercise medicine program. And in terms of our student participation, so we went from the first year to a couple of hundred students participating because we were only able to offer a small amount of activities on campus, to now we have thousands that participate in our program, and I foresee that growing as we're able to develop more support for our program. So, and looking at some of the challenges that we had here with our program, I would say in terms of university administration, so like Kori mentioned, there are many different groups across campuses that offer activities, events, resources that duplicate the efforts of our exercise medicine on campus program. And so trying to get the support and collaboration with those other programs has been a struggle for us. So for example, we would offer fitness assessments, and then next thing you know, another group is offering fitness assessments. So it's trying to bring together all of the groups to get so that we can not duplicate resources and effort. The other challenge that we've had is with our communication. So I mentioned before our wellness program and our student life, and the students have been helpful with communication, but trying to get support in creating marketing videos and utilizing the campus or the college mascot in different events. So for example, the mascot challenge, that has actually been one of our challenges. Next, which is our major challenge, is that we lack a physical student health center. So we're unable to assess physical activity as a vital sign like we want to, and offer that referral system because we lack that physical student health center. So currently we're in the process of collaborating and working with counseling and advising to see if we can set up some sort of system to assess physical activity as a vital sign, and also put together some sort of referrals system that will support our 4-week personal training program as well as other activities on campus. So I think that will, if we can get that in place, that would be awesome. Last, like many other institutions, we lack the financial support to really take the exercise medicine on campus program to another level. So whereas our department provides us with a little bit of financial support, we lack the major financial support to run our programs. So like many of the others that you've heard, we've had successes and we've also had challenges. And many of the challenges are, especially for the community college, which is unique, is that lack of the physical student health center and that referral system. So getting something in place. So thank you for listening. And I guess we'll take questions.
Yeah, thank you very much, LaKisha, for sharing a very different perspective than some of our other schools. And that's part of the goal of our webinar. Our webinar series is to share different perspectives, both the challenges as well as the successes, so that we can continue to push exercises medicine on campus further and add additional schools, which I'm excited to say that this year at the recognition ceremony, we will have a significant number of additional schools that are being recognized. But also then, as the exercises medicine on campus committee, identify those challenges that exist for our schools and work for creative solutions to be able to address that. I can say that one of the things that we are looking at as we come into the next year is actually trying to find ways to help support the establishment or the progression of exercises medicine on campus programs across programs. Now, I can't talk about what that support's going to look like, if that's going to be grants, if that's going to be other sort of support, but that's something that we as a committee are highly aware of, and it's something that we do need to work on going forward. So, Shelby, do we have some questions from our audience?
We do. We'll start with this first one here from David. David asks, how are various physical activity programs supported? For example, if a student is referred to the ARC for program or for physical activity guidance, then is the trainer at the ARC funded through the ARC, or are they volunteers from the exercise science department? How are they supported? Kori, I think you're on mute. That's okay.
Technology is great when it works.
Thank you. Great question. As far as support as a personal training goes, we don't have anything in place for that. Scarlett is the director that will show them the facility, and all students included in your tuition have a free membership to the ARC, which includes all of the classes, all of the fitness equipment, and the aquatic center. But personal training and small group training are at an additional cost and is not included or supported just by simply being referred.
Great.
I can tell you at FGCU, initially, the personal training component through Campus Rec, through our referral system, which was happening at Campus Rec, was supported through their marketing budget. They had some marketing dollars that were set aside for sort of free personal training. They were using those marketing dollars to support the Exercises Medicine on Campus program. Now, almost 5 years later, it is actually a budget line item, and then we use our exercise science students as sort of backup for when we have more students referred than can be handled by the staff that is sort of responsible for that at Campus Rec. So I think one thing I would say to schools to keep in mind is the fact that oftentimes in the beginning, identifying funding is challenging, but as you establish your program, you start to show success, you start to show how it highlights the benefits of your campus community, then there's some other internal funding that tends to make itself available.
And just to add one last point to that, I know I mentioned the peer health coaching, and the first year that we rolled that out, it did have a little funding, and so that internal grant was able to pay for participants to do that small group training, and the instructors at the ARC, the trainers, were paid. It wasn't exercise science students, so the ARC trainers gave those small group classes at no cost to the participants. But in the next year, without that funding, the small group training piece was not able to stay a part of it.
Great. This next question asks, how do you assess the efficacy of various programs? What metrics are used and how are they tracked? Who performs these assessments, collects and analyzes the data? And how is that data used to inform future programming efforts?
Wow, that seems about like 6 questions. So we may have to have you repeat. I'm going to have our speakers try to answer that first, and then I will pop in on the back end.
Okay.
Okay, I will again go back to the peer health coaching study. That was as far as my knowledge goes, the only place we did look at efficacy, and it was via a survey. And to make sure I hit all of those questions, the faculty advisor, principal investigator of the program was the one who analyzed the data and has passed along the findings to the ARC to talk more about what that looked like, and with the future health coaches, how to improve the self-efficacy. Is there another question in there?
I think you might have hit all of them.
Professor Nickens-Gaither, do you want to comment in on how you guys are collecting and analyzing various data on your end?
Yes. So we actually use surveys as well to collect data, as well as sign-in sheets at every event. So we can track exactly who attends, if they're faculty, staff, student, alumni, whoever. And so that's literally how we're tracking and analyzing data is through surveys and SurveyMonkey.
And then is academic faculty doing the analyzing of the data, or is it other staff that are on campus?
Actually, I do most of the analyzing, collecting and analyzing of the data. So the supervisor of the program.
Gotcha. Actually, the way that we have restructured as our FGCU program has expanded is that our campus rec runs the program, or student affairs side of the house actually runs the day-to-day operations of our exercises medicine program. And my job as the faculty attached to the program is simply creating the study design that allows for data collection, as well as doing the analyzing on the back end. For faculty that are on the call, that does fall under a lot of us that are doing a lot of work in exercises medicine use that as our research time at the university, and so it's worked fairly effectively doing that. I have also found, since we're sort of talking about collaboration, that our campus rec in general has collected a fair amount of data that they have analyzed at a very top level, but haven't necessarily delved deeper into. And sort of as they do a lot of work on exercises medicine in their free time because they're passionate about it. And so then I spend some of my time actually looking at some of the data that they have that may or may not be related to exercises medicine, but helps them to further provide information to administration on why programs like these are important, because administration, I think we all recognize that administration is looking for hard data to show why additional funds should be spent in specific areas.
Great. Shorter question here from Nathan. He's asking if Professor Nickens-Gaither can explain more about the Zumba Against Cancer event.
Yeah, so sorry. The Zumba Against Cancer event is usually held during Exercise Medicine Month, and so we collaborate with different organizations on campus, Student Life and Wellness. So Wellness usually provides us with the Zumba instructor, and it's open to the entire college. We kind of encouraged them since October's Breast Cancer Awareness Month. We encouraged them to wear pink. They get some sort of gift for coming in, and so there's an hour of Zumba and everyone in pink, and that's like one of our biggest events that we have on campus.
Great.
So do the students pay to, just as a clarifying question, do the students pay to participate and then funds go to a breast cancer organization, or is it more of an awareness event?
It's more of an awareness event, so no money is collected.
Another question about one of your programs, Professor Nickens-Gaither. How Stella really likes your veterans program, and how do you operationalize the open gym times for them?
Okay, so the Combat to College program is run by another organization on campus, but what they do is they offer open fitness hours every week to veterans, and so they actually get to utilize our weight room versus our bigger fitness center, and so the program is run by a veteran, and so he provides fitness, workouts, all types of things available to them. So yoga and like CrossFit type workouts to them.
So I have a follow-up question, because I think that sounds like a fabulous program, and it's definitely something that tends to get people fairly passionate as well. Do you are the combat veterans that come and utilize the facility also students, or is it open to the larger veteran community that's in your area as well?
That's a good question. I believe right now it's only open to students, faculty, and staff at the college.
Great. This question's for Kori. Michelle is asking, what curriculum did you use to train the peer health educators?
The specific name of the curriculum, I'm not sure. It was duplicated from what Dr. Carissa Pyer had been trained on in the past. It was 8 hours of training in total. We did 4 different sessions, 2 hours each. I'm sorry, I don't know the name of the curriculum.
Okay. You could always get that back to me, and I'll write Michelle's name down so we can get that. Okay. Okay. Back to kind of the efficacy of the programs, what have you all found to be the best metric to track to evaluate the value of different programs that you've done?
I'll let our speakers go first.
That's a good question. So we look at participation. So at every event, we collect data by either doing a SurveyMonkey in order for them to attend, or some sort of sign-in sheet. And so programs that get really good attendance are the ones that we keep running, and those that lack attendance, we kind of take out of the program.
Yeah, I would simply second that. I know some of our other events will have follow-up open-ended questions to get just some unstructured, genuine feedback from participants or from student leaders, and that helps give a little more insight into the value and what was gotten from the program or the event.
So I think from the Exercises Medicine on Campus committee perspective, those institutions that have a referral network, whatever that referral network looks like, I think two pieces of metrics that are interesting for the larger community is one, since we're quantifying the volume of physical activity that they're doing as part of the PAVS question and the EMR on a piece of paper in the referral process, the volume of activity or the number and percentages of students or types of students that are meeting the recommendations and or not meeting the recommendations on your campus. I think that that's a very important metric that we need to be collecting so that we can see population-based shifts over time with the implementation of an exercises medicine program. I think another metric that has been talked about that is also equally as important, and we need to keep in mind that more often than not, the individuals that are referred to an exercises medicine program are the individuals that we as a field have the biggest challenge engaging in physical activity, right? These are individuals that have tried and failed multiple times in the past. They may have other comorbidities, so their barriers to starting an exercise program are high. So the number of students that are actually get the referral, that conversion rate, the number of students that get their referral and then actually participate in the program, I think that that's an important number. Now, I don't think that any of us should expect that number to be 80 to 90% because it's just not going to happen with the populations that we are targeting. However, things like how many, for those programs that are set up, and we actually talked about this a little bit before the call, set up where they can actually physically follow up with the folks, the individuals that got the referral, the number of times that it takes for that person to be contacted before they actually come back. I know that FGCU, we did a short study looking at a subsection of the individuals that we had contact information from and how many times we needed to reach out for them before they responded. The interesting thing is the fact that of the students, then there was about 100 in that sample, of the students that we polled, they answered the survey, right, but claimed that they had never received an email from us, even though we had physically sent them 3. Okay, and so what we are finding that it's probably somewhere between, with some of these individuals, somewhere between 5 and 10 contacts before we can actually take them and move them to the point where they'll actually start to engage with the physical exercises medicine program. So I think metrics like that are equally as important. I completely agree with our speakers. The number of participants that participate, oftentimes the participants in some of the exercises medicine programs at different institutions are not the individuals that are coming into places like the ARC or the fitness center, right? They're starting to engage in programs that are outside the physical building that, again, may be a barrier for some people to enter. So I think identifying for your institution what are its biggest pain points, and if you can tie the program back to what those pain points are. For example, if you have a beautiful large facility and you don't have students coming in to use it, would be beneficial as you start to move the program forward to seek additional support from an administration internally.
That's great. Thank you. Michael,
that may have been too much information, but
no, I think that's really good. I think people like that. So Michael says, thanks for a great webinar. Can someone clarify whether the exercise professionals at the Student Fitness Center have to be ACSM certified? Should that be a limiting factor if those professionals are not ACSM certified?
I'll jump in and take this one. So I think in an ideal world, the individuals that are working with exercises medicine students would have a third-party accredited certification, whether that's ACSM or NSCA, that they would have not a personal training certification that would be unique just to the institution. They would have a nationally recognized certification. I can also tell you that the exercises medicine credential credentialing committee is currently in the process of updating and streamlining the process by which individuals can get the exercises medicine credential on top of the other certifications that they may have. And I also would challenge people to say that that's a great way to sort of show a minimum level of competency for the individuals that are working with your exercises medicine population. Now, I do know at many schools, I think we have to keep in mind that we're also academic institutions. Oftentimes, there are students that are doing either intake or personal training, etc. Those students are most 99.5% of the time overseen by either faculty that are qualified to do that overseeing or staff that are highly certified and credentialed to be able to do that overseeing as well. And so we see that as an often as a way to do it. And I don't know that I personally think that that's a bad idea. We are training institutions, and I think exercises medicine on campus programs can do a lot to provide hands-on opportunities for our kinesiology, exercise science, health promotion students.
Perfect. Adam's asking, for a university without an exercise and sports science department or any related departments, what is the best way to get students involved in programs such as the 4-week personal training program? Any advice or recommendations?
I can tell you that there's actually several schools that have been recognized at the national level for their exercises medicine program that do not have any academic program in exercise science, kinesiology, or sort of a related field. More often than not, it is run through their campus rec program. Campus rec is the primary source for that if there's not an academic institution. However, in the past, over the last couple of years, we've actually seen some really interesting and creative exercises medicine programs and initiatives coming out of nursing programs as well. So other health, I think if you have a school that it doesn't necessarily have an exercise science related program, but has some other health related program, that those are great individuals to engage in the exercises medicine on campus process, because those are the ones that will go out into the field as providers and then hopefully take that knowledge to help refer their future patients to qualified health professionals to get the support that they need to increase their physical activity levels.
And I would just add one thing of going outside of the traditional 4-week training, things, May, I know you touched on this a little bit, but things like step challenges or outdoor trips just to increase overall physical activity don't necessarily need a exercise science health professional to get people moving more, which is really the name of the game.
I think that's Kori, I think that's a really good point, that it doesn't, though the most robust implementation is the referral network and a multiple week training program, that is not the only way to implement an exercises medicine program. And to Kori's point, the ultimate goal should be to provide opportunities to increase physical activity and to engage people in those activities.
That's great. This question kind of goes along with it. Joanne's saying, if we don't have any funding available, what kinds of events can we hold to engage the student body? So do you guys have any recommendations? I know you spoke a little bit about your activities that you've run. Were any of those specifically without funding, or do you have any ideas?
Yeah. Most of our programs are run without funding. So the walking programs, walking challenges, swim challenges, they're all run without funding. So I think those are some of the some ideas of programs that could be run without funding, as well as, you know, other physical activities. So for example, we also offer like annual kickball games and activities that are outside the scope of regular exercise to our students.
Kori, do you have any programs that are 100% unfunded that you're implementing?
Yeah, most of ours are as well. And I would say utilizing student organizations, and again, whether they're have an exercise or health focus or not, they tend to, one, have a community that is, we're already working together and wanting to put their own name out on campus. And if they are able to do something that is active, the reach that they have and the manpower and pre-existing community that they have might be a good avenue to explore, even if it's a chess club or something. I think just kind of sparking that, hey, what would you all think of doing something that involves a little more physical activity, and see if there's any interest or motion set there, or could be.
Yeah, I think in general, tacking on to existing events that you could potentially add an additional exercise component to, or exercise education component to, using faculty, staff, or students, sort of whoever's available. Community members are also often very interested in donating their time to come to campus to help share that information. I know our local Red Cross is happy to come in and talk about cardiovascular health and stroke awareness with some of the bigger events that we do on campus. We also partner, for example, with our counseling and psychological services department when they do their walk in darkness, which is suicide prevention. We add in, though it's a walk, we add in another additional, the exercise science students add in an additional level of the benefits of physical activity and how it can help to improve mood and things like that. So we function as the educational side of that.
Okay, this will be the last question, and it's a follow-up actually to that question before. For those non-funded programs, do you or have you ever given out incentives like prizes or things like that? And if you have, how did you get those if it was a non-funded program?
That's a great question. Many of our giveaways come from other departments with collaboration, so Student Life, our actual department, and we've used Wellness, we've used various other campus programs to solicit or to get giveaways for events.
As well, a lot of our small swag and giveaways comes from the department and other on-campus initiatives. And we have been able to use, Renee touched on community partners, as their presence and knowledge as an incentive of a speaker. And I don't know if that's really what you were looking for as far as a giveaway, but something to get, that's different to get people out.
Yeah.
Mm-hmm. I think one of the things that I would challenge you to take some time and look off campus, where FGCU is located. We have several fairly large shopping areas that are close by us, and oftentimes they will give us coupons for a free something to go, a free appetizer to go with a meal, or various other things in order to get the students to engage with their retail establishment. And so it's not necessarily a t-shirt or a water bottle, but it is a way to sort of have some things to give away that are a benefit for those individuals that are participating.
I know one other thing that we've done, and maybe is not ideal, but use one item, and we've used Groupon and been fortunate enough to have a faculty or staff member that's willing to personally get like one item that's really attractive and then make it a raffle. So if you participate, you're entered in to win this one thing rather than needing enough little things for everyone.
Oh, that's
that's
really
some of the things we do too.
Do you?
Yeah. Other resources, the campus bookstore as well. So they've been able to donate stuff, and then we use that as a raffle to give off gift cards.
That's great. Thank you guys so much for your answers to those questions. And that's all the questions that we're going to take to end on time.
Okay, so I just want to take a couple of seconds and thank our presenters for taking the time out of their busy schedules to not only pull together a presentation, but also share their experiences with Exercises Medicine on campus. If you have additional questions, either for the presenters and or for the Shelby or myself, please feel free to email them. We're pretty good about getting back to them in about 24 hours. We want to make sure that these webinars share information and that our schools that are working on Exercises Medicine on campus have as much support as necessary. I am going to put, here is my plug. The national meeting is coming up at the end of May in Orlando, so all of you from up north get to come down and enjoy our beautiful Florida weather. There's a couple of sessions that I want to make sure that you're aware of. One is on May 29th at 3:15 in the afternoon, and that is the Exercises Medicine Symposium. As many may know, Exercises Medicine celebrated its 10th year last year. Exercises Medicine on campus celebrates its 10th year this year, and that will be actually perspectives from university leaders on the Exercises Medicine on campus program. So we have campus presidents and provosts coming in to talk. I think if you're wanting to know what administration thinks of the program, this is a fabulous opportunity to listen and hear their perspectives on Exercises Medicine on campus. And then for all of our schools, our recognition ceremony is the same day at 5:30, and we would love to have you come. If you're at the conference, we will be handing you your certificate and we take a photo and then we take a group photo at the end. But if you'd like to see the types of schools that are getting recognized at the various levels, this is also a great opportunity to network before and after the ceremony with schools that are in your area that may have some unique regional ideas on how to get and improve your Exercises Medicine on campus program. So we're super excited to see everyone hopefully at the national meeting at the end of May. So thank you to our speakers. Thank you to Shelby for keeping us all under control. And we will see you all on our next webinar.
Thank you.